I want you to know that one man can change medicine. One man can make a difference in the world. This is Alan Mintz. And you are all sitting here, and I am there you go, and I am standing here because he made a cognitive decision in 1997 that medicine needed to have a shift, that we could no longer be about treating disease, and that our sole purpose, or one of our purposes in medicine, is to allow those who are embedded in the disease-oriented system to do their job extremely well, but to design a new branch of medicine. And he was the one who coined the term age management. The AMMG, which is this body of physicians and healthcare professionals, is a direct result of that conscious decision. Now, you're sitting there, and some of you are, most of you, how many of you still have active practices? Raise your hand. So the majority of people in the room still have active practices. And out of that group that has active practices, how many do exclusively age management medicine or some form of age management medicine? I can only see about 10 hands, maybe 12. So out of this organization, there are 10 or 12 people who practice age management medicine exclusively. And I can remember in 2004, or maybe it was 3, I was asked to give a talk to the AMMG group in Fort Lauderdale, Florida. I live in Boca Raton half the time, in Vegas half the time. So I was given a talk to the group in Fort Lauderdale, Florida, and I promise you, these two tables would not, there were fewer people than there were at those two tables. We have grown by 50 or 60% every single 6 months. So this conference goes on again in 6 months in Florida, and then we have one in November again in Boca Raton. But the reason we're here is because medicine needs to change. And I, for one, really want to thank you for being here, because while he had the vision, you're the ones that are going to make it happen. Medicine, as we know it, will have to go through a major revision. And you're the ones that are going to make that revision occur. Those of us that have been doing it for 10 or 12 years, you know, we know what we do is fun. You haven't discovered it yet. This is the reason you went to medical school. This is the reason you're here. And you're here because you want to treat your patients in a better way. Okay, you can put on my first slide now. How many people in this room use growth hormone? Again, a dozen, maybe 10. So most of you, even the ones who are practicing age management, know very little about growth hormone, because what you know about growth hormone is what the media has told you about growth hormone. So what I want to do today is leave you with two things. I want to leave you with knowing a little bit about adult growth hormone deficiency, because when you see the signs and symptoms, you're going to go home and you're going to question how many people you see all the time that are adult growth hormone deficient. And yet, it's one of those treatments that is restricted from the medical care system for two reasons. Number one, the Endocrinology Society doesn't really want to accept the fact that a deficiency or an insufficiency creates enough chronic debility to treat it, because it's really not a disease. It's really an insufficiency. But look at, you heard Neil Rosier's talk earlier today. You learned one thing, I hope, and that is you can't look at TSH and T4. You've got to look at T3. There are 50% of the people that you see with minor thyroid deficiencies are T3 deficient. And yet, we treat them with Synthroid. And I'm sure there are endocrinologists in the room who use Synthroid, and I'm not saying you shouldn't. I'm just saying there's a better way when you understand that insufficiency is just as important as a disease. Insufficiency creates disease. So when Alan coined the term age management medicine, his purpose was to change the way you age, to change the way we deal with chronic illnesses, to prevent heart disease, strokes, the debility of the aging process. Because here's a flash for you. Ready? You're all going to croak. And we're not going to stop it. We don't even know that we're going to prolong your life with age management medicine. But what we do know is we're going to prolong the productive way you live. You don't age without work and not develop chronic illnesses. You've got to eat right. You've got to exercise right. You heard Mickey Barber talk today about adrenal problems. Most of you have no concept of what an adrenal insufficiency is, because unless the adrenal gland shuts down, there's no knowledge of how cortisol is affecting the other hormones. So what I want you to walk away from here is a little bit of knowledge about growth hormone and maybe a little bit of passion about bringing this to modern day medicine so that physicians are not afraid to treat patients with a deficiency of a hormone that may be responsible for many of the causes of mortality in the aged population. And I'm going to talk briefly about growth hormone. I'm not going to go into detail about it, but I will tell you this. In 1999, when I became interested in hormone optimization, I had already been doing exercise and nutrition and supplements and all of the things related to lifestyle change, but I didn't know much about hormone optimization other than progesterone and estrogen in women and testosterone. But growth hormone at the time in the late 90s was still in its early phase. So in the early days, we used a lot of growth hormone in the age management business. Probably 40 or 50% of our patients we felt were deficient in growth hormone. And then things changed. And I'll show you what changed. But most importantly, what happened is we lost the concept that this is adult growth hormone deficiency. And today, we need to learn how to diagnose it. So you're going to leave here with two things. One, that there is actually a deficiency of growth hormone that has a chronic, debilitating effect on the aging process. And two, how do you make the diagnosis of growth hormone deficiency in 2011 according to what we're required to do in order to safely use growth hormone so that the medical board is not chastising you for not making the proper diagnosis. So those two things, if that's all you get out of this, my job's done.